Uterine fibroids. We all know someone that has uterine fibroids. Uterine fibroids are probably one of the more common reasons that women have hysterectomies or have their uteruses removed. So what are uterine fibroids? Uterine fibroids are basically a proliferation of cells in the musculature of the uterus. The uterus, which is normally about the size of your fist, is made predominantly of smooth muscle. And fibroids are formed when the cells of the smooth muscle become hyperplastic, or they proliferate or grow, if you will. And fibroids typically are small bundles of these hyperplastic cells. So I've seen fibroids that, are anywhere in range of size from a pea to as large as like a cantaloupe. A couple of years ago, I removed a uterus that was about the size of a watermelon. So that was roughly about a 25-week size uterus. Fibroids are benign. I'm going to quote you roughly about 97, 98% of the time. The issue with fibroids is that they can cause your uterus to become enlarged, which in turn can cause a lot of pelvic pressure or heaviness. Fibroids are typically associated with really heavy periods that can cause women to become anemic and require blood transfusion. Fibroids can cause what's called mass effect, where their size can put pressure on your bowel as well as your bladder and lead to bowel and bladder issues. Fibroids can also be completely asymptomatic. Lots of women discover that they have fibroids by virtue of an ultrasound that was for something else entirely different. Fibroids in that circumstance can just be watched, because again, if the fibroids are not causing you any significant symptoms, there's nothing to do with them. Fibroids also can cause issues depending on their location. A very common question that I get is, oh my gosh, I want to get pregnant. Are the fibroids going to interfere with my pregnancy? I happen to have been a woman that had fibroids during her pregnancy. And because the fibroids did not encroach on the endometrium or the lining of the uterus, there were no issues during my pregnancy other than, some pain from, fibroids can sometimes necrose during a pregnancy. And so that was a bit of an issue. But with regards to the baby and conception, as long as fibroids don't interfere with the lining of the uterus, they typically are not an issue. But we do just keep an eye on them because they can continue to grow. When fibroids do encroach on the lining of the uterus, they can be associated with increased risk of miscarriage, preterm labor, malpresentation, if the fibroids interfere with the baby's ability to move around inside the uterus, etc. Since we're talking about fibroids and uteruses and treatment options, one of which again is observation, I typically don't recommend myomectomies unless they're in the way. So if you're someone that's trying to get pregnant and the fibroid is encroaching or interfering with the lining of the uterus, that may be a circumstance where your doctor may recommend a myomectomy, which is removal of that fibroid away from the lining of your uterus. Fibroids, again, can be completely asymptomatic. If they are causing significant issues, if you are done with childbearing, one of the options for treating them is having the uterus removed in its entirety. Fibroids are hormonally responsive. And so as long as your ovaries are working, they will continue to grow. So that's, again, one of the reasons that we typically keep an eye on fibroids. And I recommend minimally an ultrasound annually just to make sure that fibroids aren't growing too rapidly. If fibroids are growing too fast, too soon, then something called a leiomyosarcoma comes to mind. That actually is a cancer, but that's exceedingly rare. So again, another reason to keep an eye on your fibroids. Keep in mind, there are ways to treat symptoms that are being caused by fibroids without actually removing the uterus. If the fibroids are only, causing heavy periods, then there may be a way to address that, whether it's an ablative procedure, whether it's an IUD, etc. Hysterectomy or removal of the uterus is really a last kind of resort with regards to options for treating fibroids. Another kind of minimally invasive or conservative approach to treating fibroids outside of hormonal recommendations to help with heaviness of bleeding and periods would be something like a uterine artery embolization, which is a highly underutilized measure to treat fibroids. Interventional radiology typically does that. What they do is they go through your, I want to say, femoral artery, and they inject some pellets, if you will, which occlude the uterine arteries and help to decrease blood supply to the fibroids, hence causing them to shrink, hence causing them to not cause your periods to be as significant. I've had several patients, actually a lot of women, that resort to uterine artery embolization because, again, they want a less invasive approach to managing their fibroids. So if you're someone that has uterine fibroids, I think, number one, knowing is half the battle. Talk to your OBGYN to make sure that things are stable. If you are having significant symptoms, you can discuss with your OBGYN various treatment options. But just know that typically fibroids are benign. They can range in size from pea size to grapefruit, cantaloupe size. Treatment is individual and it depends on you. So hopefully this small piece on uterine fibroids has shed some insight into what they are, how we diagnose them, how we treat them. Talk to you soon.